I now note that the hour has come. Ms. McDonald, will you please call the roll to take attendance? Members that are in attendance, will you please indicate that you are present when your name is called?
Councilmember Gilmore Richardson, Councilmember O'Rourke, Councilmember Jones, Councilwoman Gautier, Councilmember Phillips,
Present.
Vice Chair Squilla,
Present.
Chair Driscoll.
Present. Thank you. A quorum of the committee is present, and this hearing is now called to order. This is the public hearing of the Committee on License and Inspection regarding Bill Number 240430 and Bill Number 240665. Ms. McDonald, would you please read the title of the bill?
Bill number 240430, amending various provisions of the Philadelphia Code to authorize revisions of various fees by regulation, including license and permit fees under Subcode A, the Philadelphia Administrative Code, license fees for food establishments under Title VI Health Code, license and permits under Title IX, Regulation of Businesses, Trades, and Professions, license under Section 10-722, use of dumpsters, license under Section 11-610, construction equipment, and license under Chapter 19-600, amusement tax, all under certain terms and conditions. And Bill number 240665, amending Title 10 of the Philadelphia Code entitled Regulation of Individual Conduct and Activity by adding a new chapter concerning vehicular mobile service providers and providing for penalties, all under certain terms and conditions.
Ms. McDonald, will you please call the first panel we have to testify this morning on Bill Number 240430?
Sarah Adamo.
Good morning, Sarah. Please state your name for the record and proceed with your testimony.
Good morning, Chairperson Driscoll and members of the Licenses and Inspections Committee. My name is Sarah Adamo, and I'm the Legislative Affairs Manager of the Department of Licenses and Inspections. Today, I am here to provide testimony on Bill number 240430, introduced by Councilmember Driscoll for Council President Johnson, which, if enacted, will amend various provisions of the Philadelphia Code to authorize revisions of various fees by regulation, including license and permit fees under Subcode A, the Philadelphia Administrative Code, license fees for food establishments under Title VI Health Code, license and permits under Title IX, Regulation of Building, Trades, and Professions, license under Section 10-722, use of dumpsters, license under Section 11-610, construction equipment, and license under Chapter 19-600, amusement tax, all under certain terms and conditions. Since Bill number 170165 was enacted in 2017, LNI has been authorized to revise by regulation permit and license fees under the following conditions. The fee shall be based upon the cost to administer and enforce the applicable programs and services, and no fee shall be increased to an amount higher than the fee as it existed on July 1st, 2017, multiplied by the Consumer Price Index CPI multiplier. Since 2017, LNI has authorized these code provisions to increase fees based on increased operational costs and the CPI multiplier. However, fees established after July 1st, 2017 are not able to be increased in the same manner. If enacted, this legislation would add the same provisions to fees that were established after July 1st, 2017, and fees established before July 1st, 2017 that were inadvertently omitted from the previous legislation. This legislation will create a more uniform and predictable method for all permits and license fee increases. It is also important to note that passing and enacting this legislation will not immediately result in the modification of permit and license fees. Fees will only be increased after appropriate analysis is performed and associated regulations are promulgated. The department is supportive of this legislation. Thank you for the opportunity to provide the testimony for the Department of Licenses and Inspections. I'm happy to answer questions at this time.
Thank you, Sarah. I would like to note the presence of Councilmember Jamie Gautier that joined us this morning. Good morning, Councilmember. This is important legislation, and I was happy to introduce it on behalf of Council President. Getting some uniformity into this and predictability, I think, is really important. And I'd like to ask if any of our council people would like to make a comment. I recognize Councilmember Phillips.
Thank you, Sarah. How are you this morning?
I'm good, thank you.
Good, thank you. Just some quick questions that can help the public understand what's about to transpire, so I want to be helpful here. Could you provide examples specifically, or in terms of programs or services that would benefit from this fee adjustment authorized by this legislation? Like how? There you go.
Sure. So currently, all of the permits and licenses that LNI issues that the fee was established prior to 2017, we already have the authority to do these increases. What this legislation would do is take some of the more recent fees and ones that were inadvertently omitted from the last legislation, such as dumpster fees, and it puts them into the same bucket as the other ones. So when we do our fee increases, we'll analyze how much our cost to administer the services has gone up, and we'll compare that to CPI multiplier. We'll take the lesser of those two things, whether it's the price index or our cost to administer, whichever one's lower, and we will increase our fees across the board evenly. So this way, we're not increasing some fees one way and some fees another way. This way, it's all uniform across the board. And like I also mentioned in the testimony, which I think is important to reiterate, this bill itself doesn't increase the fees. We still need to go through the regulation process to do that. So there still is transparency to the public before these fees are increased.
Thank you. And just two quick questions. One, I want to thank the chairman. He's absolutely right. This is a really important piece of legislation for our city. I just want to also understand that, so our city understands, like, it's completely aware that transparency is really important, as you just mentioned. How does the department plan to ensure transparency and public engagement during the analysis and regulatory process for adjusting fees under this legislation?
So they go through the regulation process. We do an analysis, but when our regulations are posted, there is a 30-day period where a hearing can be requested. In the past, that hasn't happened. Most of the time when we go through this regulation process, we don't have hearings requested, but we also put this information on our newsletter, on our website, so there are different ways that the public would be aware that the fees are increasing.
Okay, and are you taking steps to ensure that the fees remain affordable for small businesses?
Our fees, so the way that this would work is that, they're pretty much in line with the CPI multiplier. So, if there's inflation across the board, it also applies to us. But also, our fees can never be more than the cost to administer the service. So we're not working at a profit here. We're only covering the cost that it takes to actually process your permit, to do inspections, that type of thing. So our fees can't be exorbitant.
All right, thank you, Chairman Driscoll.
Councilmember Phillips, that was insightful. Thank you for that. Hearing no further questions from our committee up here, Ms. Adams, thank you for your testimony.
Thank you.
We will now call witnesses on bill number 240665. Ms. McDonough, will you please call the first panel? We have to testify this morning on bill number 240665.
Frank Franklin.
Good morning, Chair Driscoll, Vice Chair Squiller, and members of the Committee on Licensing and Inspections. My name is Dr. Frank Franklin. I'm the Interim Health Commissioner of the Philadelphia Department of Public Health. Thank you for the opportunity to testify regarding Bill number 240665, introduced by Councilmember Lozada. The bill proposes restrictions on the locations where vehicular mobile service providers can operate within the 7th Council District. These providers would be prohibited from operating on residential blocks. PDPH, or the Philadelphia Department of Public Health, recognizes that the residents of the 7th District are exposed daily to harrowing conditions related to the opioid crisis. We appreciate the dialogue initiated by Councilmember Lozada's office with PDPH to address the impact of these conditions on her constituents. The definition of vehicular mobile service providers includes vehicles from which medical and social service professionals provide care to individuals with opioid use disorder and other medical issues. PDPH provides technical assistance two mobile healthcare providers operating in the 7th District. We support their work to medically stabilize people, including those experiencing the effects of fentanyl use who need wound care and prescriptions for medications for opioid use disorder. PDPH also supports the stated goals of this bill, which are reducing the accumulation of waste and hazardous materials from vehicular service providers, reducing nuisance behavior associated with the congregation of people receiving services from mobile providers, and preventing traumatization of children in the neighborhood. We welcome continued dialogue to ensure that Bill number 240665 achieves these goals. As written, the bill will be difficult to enforce in a way that achieves these goals. I would be happy to answer any questions that you may have at this time. Thank you.
Thank you for testimony, Doctor. We do have the maker of the bill here, I think, what wants to interrogate.
Yeah, thank you, Mr. Chair. I just wanted to make brief remarks. Thank you, Commissioner Franklin. Thank you to all of you who are here today. Mobile service providers play a critical role in delivering the much-needed support to individuals experiencing homelessness and addiction. Their efforts have undoubtedly provided relief to some of the most vulnerable members of our community. However, the way many of these services currently operate has had unintended and deeply concerning impacts on the quality of life in the communities where they conduct their work. Their presence often results in excessive litter, large unmanageable crowds, and disruption to everyday life. These problems are not confined to one area. They occur in front of homes, schools, and on public sidewalks, creating concerns and straining the resources of both residents and local offices and local officials. In some cases, these providers are operating without the proper licensing, further complicating efforts to ensure their services are delivered in a way that respect both their clients and the neighborhoods where they operate. This has been an ongoing concern that is a product of the mismanagement of the opioid crisis. Today, you will hear from stories from the residents who have experienced the consequences of inadequate oversight. Their experiences underscore the urgent need for action. An underlying common theme of their testimonies is that this does not happen in other neighborhoods, so why is it allowed in theirs? This isn't about denying critical services to those who need them. It's about making sure that these services are provided in a responsible, sustainable, coordinated manner that consider the needs of everyone involved. The lack of oversight and clear guidelines has created a fractured relationship between the service providers and the communities they serve. Residents remain unheard, overwhelmed, and frustrated by the lack of communication and accountability from these organizations and the dangers and the trauma they have to live through. We can and must do better. This legislation we will consider today is one step in providing the regulation that is needed. These two bills will ensure that the proper disposal of waste and limited disruptions to public spaces. These changes are necessary to rebuild trust and create a framework where life-saving services can coexist and thrive in the communities. In these chambers, we are here to do the people's work. I look forward to working today with each of my colleagues to ensure that the people we hear from today are able to live with dignity and standards just as residents from the neighborhoods they serve. I just want to be sure that we understand, or that everyone here understands, that the goal is not to end mobile provider services. We understand that they're life-saving services. We recognize that the work is absolutely necessary in order to continue to have conversations with the individuals who come to receive services. The goal of this bill is to ensure that we are not disrupting the day-to-day lives of the people on residential blocks. We often hear that when these services are being provided on residential blocks, it causes residents to have to fight people off of their steps, right? It causes them to have to fight for parking spaces. It causes them to have to put up with the excessive amount of litter that is left behind. And so I just wanted to make sure that I'm clear about that, right? I think that we have talked for a long time about coordinated services. In 2022, when I arrived here, I attended a meeting on behalf of Councilmember Squilla, where there was a commitment by the City of Philadelphia and the administration that we would coordinate mobile services, that we would do the necessary work to make sure that these services were provided in a way that was responsible. And here we are, 2024, almost 2025, and we still have not done what we committed to the people, which was to work towards coordinating services in a way that didn't disrupt quality of life. And so I hope that this bill puts us on the path to being able to coordinate those services in a way that that people feel both the dignity of those receiving services are respected, as well as those who live there. Thank you.
Thank you, Councilmember Lozada. And I know it's not a lack of compassion. I've been working alongside you down there. These are not incompatible. I think we can do both. I think it needs to be orderly. I think it has to be regulated. So this is the beginning today. Let's just get this out there. Let's have a robust conversation. Let's get it right. I do know that Councilmember Phillips does have a question for the maker of the bill.
Thank you, Councilman Lozada, for working on this for your district. It appears to be a serious concern. And I just want to ask you, can you describe for the public who's listening, how this is impacting, examples of how this is impacting residents, things that people have said and they've seen and they've come to you about in terms of mobile services being near their steps and so forth?
Yeah, thank you, Councilmember. In your package, there are some photos that have been shared with us in the office around what people have to go through. We've received calls from multiple people about, listen, there's a mobile provider on my block. There are people on my steps. I can't get my kids in and out of school. I've asked people to move multiple times. The individual obviously is incoherent, and he won't move, right? How do I get my kids in without causing any further harm to this individual, right? Because it gets to the point where people are so frustrated that they feel like they have to start some kind of a fight. In some of those photos, we have a facility that is for low-income housing, and individuals are afraid to come out of there, right? So, and most of the people that live there are seniors, and so they struggle with being able to come out to go to the doctor, to just do their basic chores, right? Or travel, grocery shopping. They can't come through because they have to go through these long lines, or they have to ask people to move out of the way before they're able to go to and from doctor's appointments, supermarkets, or work. The kids, right? We've heard multiple times from some of our kids in the area that they are afraid to come to and from school because of the lines, or just because of the activity that's happening there. So it really depends on where we are and what the stories are, but the stories are all the same, right? We don't want to go, or we shouldn't have to go through all of this in order to have basic quality of life, or just go through our day-to-day.
Thank you, Councilwoman. This is, I'm looking at these photos right now, and I wish the public can see these photos of what it looks like, and it is pretty disturbing. I will tell you that if you lived near this, and you'd probably be at a point of disgust too. And, so I want to thank you, Councilwoman, for addressing the needs of the district. Thank you, Chairman.
Thank you. And Doctor, before you leave, I don't know if any questions from any of the council members. Councilmember O'Rourke?
Thank you, Mr. Chairman, and this is my first meeting with the L&I Committee. Thank you for your grace and allowing me to join with it. Thank you very much. And also this is my first time at BET, yes indeed. And blessings to you, Councilmember Lozada, as well. Mr. Commissioner, blessings to you. Thank you for being here with us. Can you provide with us an overview of the types of services and goods that are provided by the vehicular mobile service providers in the city?
That'll be a yes or a no, right? So I can give you an overview of the services that are provided among the individuals or those mobile health care providers that we could provide technical assistance to as the health department, some of our partners. Some of the services they provide could be wound care. It could also be connecting individuals to treatment, connecting individuals to prescriptions for medically assisted treatment who are experiencing opioid use disorder. There are also some other, among the other providers, when we say mobile service providers, that includes a broad array of people or a broad array of providers. From what I understand, and I don't have firsthand knowledge, but some of the other providers may provide things as blankets, food, or any other items that they feel that this population may need or may be helpful in their journey towards recovery.
You mentioned that the city provides technical assistance to mobile healthcare providers. Why does the city find their work in particular valuable? And is there evidence that suggests that these methods of care delivery are effective?
We find it valuable because most of this work, although on providing acute medical care services in many instances, it also operates as a tool for community outreach and connecting individuals to the services they need at that moment or those acute care needs, but also moving individuals into treatment, those treatment services that they desire. There is evidence that services such as this or any other type of harm reduction services, as well as an array of outreach strategies, improve individuals' outcomes for dealing with and managing opioid use disorder.
You said improves.
Improves outcomes, yes.
Why do you believe that the bill will be difficult then to implement and enforce?
I think the challenge comes into play where a lot of the definitional scope or some of the definitions within the current bill or the bill as it's presented makes it difficult to execute, and if it's difficult to execute, it's difficult to enforce. There's some ambiguity in some of the definitions, so that's where the challenge comes into play.
Okay. The restrictions imposed by this bill will appear to make it, as you pointed out already, extremely difficult for service providers to determine where they are legally allowed to operate. Will the city provide any resources to help providers determine locations that are compliant with this legislation?
After talking with some of my partners across other departments, as well as some of the mobile providers that we work with or provide technical assistance, they're all in agreement and open to supporting.
You said they're in agreement?
They're in agreement, or they're open to having the conversations where the department and the providers that we work with actually are in line with Councilmember Lozada's bill and her understanding of the problems that it may cause for day-to-day life for individuals who live in the community.
Right.
So they're open to working with Councilmember Lozada. They're open to working with the health department to sort of how can we develop a consensus and the best way to execute this, and so two things can coexist.
Heard.
If that answers your question, I'm not sure if
It does.
Okay.
Enough. Thank you very much,
Yeah.
Mr. Commissioner. Thank you.
Thank you, Councilmember, and I'd like to recognize Councilmember Jamie Gautier.
Good morning, Dr. Franklin.
Good morning.
So we heard from Councilmember Lozada, on her perspective of sort of the request that she's made of the administration and not really seeing results. But I wanted to hear that from your perspective. Can you talk a little bit about, and I know some of this predated you, but can you talk a little bit about how the admin has tried to, or if the admin has tried to meet some of the council members' requests over the last 2 years and what that has looked like? And additionally, it definitely understands your comments around the bill being hard to enforce, or your opinion on that. Is there something that the admin would like to do instead? Are you offering up something instead of the bill? And if so, can you expound on what that would look like?
Thank you for the two questions. I'll speak to the former question first. I think it would be a misstep, or wouldn't be prudent for me to try to speculate on what was done predated to me. So I would respectfully prefer not to engage in that dialogue.
But you all understand that's like why we're here, right?
I do.
Okay.
I absolutely do. I absolutely do. But I've been around long enough to understand, even although this predates me, it doesn't change the merit to Councilmember Lozada's concern.
Okay,
So I
got
haven't.
you.
So
Yeah.
we're fine with that. What we have offered up as the health department, and again, this bill as it's introduced implicates other departments as well, but I'll let those other departments speak for themselves.
Okay.
As the health department, we have spoken with our mobile medical providers. We've also connected them with the legislative and legislative representative, or what's the position called? Legislative director for Councilmember Lozada's office, to speak with our mobile providers or our mobile healthcare providers. We've offered to sort of coordinate with them. I've had frank and candid conversations with them, explicitly asking, would they be in agreement? Would they be open to having the health department have more of a direct hand in coordinating these providers, as well as considering some way to permit or provide a permitting opportunity, just a permit that verifies that these providers are licensed by the state and they are legitimate providers, or quote unquote less of a, not a bad actor.
When did these conversations start? Was this like in response to the council member introducing the bill, or did these conversations around coordination start beforehand? And then have you thought about some of the, what I understand that you're asking for conversations and you're asking people if they would be willing to coordinate, but have you thought sort of tactically about what that could look like on the grounds that could maybe alleviate some of the concerns being addressed today?
I think the conversations probably started after Councilmember Lozada's bill, given to when I stepped into this role, right? Technically, the bill had been introduced, but prior to these hearings, we have gotten other complaints and have heard other concerns. So it has been a priority for the health department prior to us getting to this point, but not specifically prior to perhaps when the bill was introduced. And your second question is, have we thought about how
I
this is going?
understand that you have made yourself available, right, to the councilwoman's legislative director. I understand that you said that you've asked the mobile units if they're willing to coordinate and sit down at the table. I think that's a good thing. I'm asking, you know, since you all do this work on a routine basis and kind of oversee this work, have you thought beyond the conversation tactically? What does this look like? Does it look like, you know, maybe the public health department getting the streets department to trail behind some of the services so we don't have sort of the trash situation? Does it look like, you know, having folks out there at certain times? I'm guessing that the health department has enough of an overview of this work that beyond offering up a conversation, you could offer up specifics about how you might address some of the council members' concerns.
I believe the most specific thing that we've offered up or put on the table for consideration is some type of permitting scheme. However, the logistics or the procedures beyond that becomes difficult to sort of speculate on because of the ambiguity of the bill. So one concrete thing that we've offered up as a department is some type of permitting scheme to see what that would look like in conjunction with conversations across our other departments in the city that are also implicated by this bill. Does that make sense, or?
To a degree. Sometimes I think that we land in these situations where we're kind of at a legislative impasse, where they're not effective conversations happening just outside of this arena. I would think that I would want to see health and L&I and others come to the table with something to address the concerns if you don't like the bill. But I think that you've answered to the best of your ability. Thank you.
Thank you.
Can I have a point of information, Mr. Chair? So I just wanted to respond, I think, to both of the Councilmember O'Rourke and Garcia. I just wanted to put on the record that we have started to have conversation with the administration about possible locations of where we could move some of the providers to. We're looking in coordination with the administration and the community to figure out what we would consider safe spaces for individuals to be able to receive these services, as well as we started the conversation about having some mobile providers be in the community, but not all in the same location, right? So if we're doing wound care on the southern end, maybe we can have wound care on the northern end. If we're having a food provider, maybe have one in the middle somewhere. I think that the problem that we have had consistently is that we can have 3 mobile care units in one specific area, and it just draws everybody to that space. Originally, when I attended the meeting for Councilmember Squilla in 2022, the conversation was supposed to be about the administration getting everyone who was actually providing these services, getting data on who they were, what type of service they were providing, whether they were officially licensed or permitted or not, right? And what days were they looking to provide these services, so that once we gathered all the information, we could figure out a schedule, right? That's what we thought we could do. Unfortunately, because that didn't happen after multiple requests, we needed to push legislation that will now force everyone to be able to coordinate the services, where, yes, they're being provided, but they're not all being provided on Ruth Street. They're not all being provided on Somerset, on Kensington, on Boudinot Street, right? They're separated in a way where people know I can go here on Wednesday to this location or somewhere in the middle, and I'm gonna be able to provide these services. Or, I'm gonna get services, but food providers also come to follow, or somebody comes with clothes. So the goal is to kind of spread them out in a way where they're not impacting one specific neighborhood. They're not forcing people to have to travel outside of their neighborhood to be able to go do their necessary day-to-day work.
Mr. Chairman, that's a question. Member Lozada, you said after multiple requests. Requests to who? Just for clarity for me.
What was that?
You said multiple requests, you decided to proceed forward with the legislation. Who were the requests to?
We were requesting them to the opioid response unit, Noelle Fosen and Kaylee is her name? I don't know Kaylee's last name.
The opioid response.
McAvoy?
I believe McClure.
Point of information?
Yeah.
The opioid response unit was who we were meeting with
Yes,
at the time.
yep. But we've also had conversations with people like, the health department. We've had conversations with L&I. We've had conversations with just the MDO in general, right? We've had multiple conversations. This is something that we've been trying to figure out for a long time. I think we're in a better place right now as a result of us putting the bill on the floor, because now we know we're going to have to legislate it, right? It's unfortunate, but we're going to have to legislate it in a way that we're making sure that there's structure and that there's order and that there's respect to the neighborhood that they're in. Because, we've heard from multiple providers that have said that they provide services differently in the Kensington Harrogate community than they do in other neighborhoods. And they don't even have to say it. We can see it ourselves, right? Community residents see the way services are delivered in our neighborhood as opposed to others.
Okay, well, hearing no further questions for this panel, thank you for your testimony. Ms. McDonald, will you please call the second panel we have to testify this
Thank
morning
you.
on Bill number 240665.
Roberto Rodriguez.
Good morning. Please state your name for the record and proceed with your testimony.
Good morning to the chambers. Good morning to council members. My name is Robert Evans, and I came to speak about the Bill 240665 about mobile providers. I'm a resident of Kensington community, and at the same time, I work as a commercial corridor manager for Impact Services, CDC. I'm here today to advocate for small businesses that deeply concerned about the state of our community. While I recognize the good intention behind distributing food and other goods to those in need, the reality is that this practice has been devastating consequence to our neighborhood. The food and the good often became waste, creating litter that attracts rats to our environment and exacerbating the already difficult condition in Kensington. Much of the assistance provider is not utilizing as intended, leading tons of trash accumulating on our street without ever being picked up. This waste poses serious public health hazard, further complicating the challenge we face due to the open-air drug market and its associated issue. Individuals openly use drugs, inject them in plain sight, and more, even defecate on the sidewalk, living in unsanitary conditions. Children walk to the school, encounter scenes not children should even have to witness, while family and business owners insurance those hardship every day. It's heartbreaking reality that no community should have to face. The Kensington community has been grappling with those problems for a long time, and we need effective solutions like Bill 240665 to address those issues rather than temporary fixes that worsen the situation. Bill 240565 is not about denying assistance to those in need. It is about restoring dignity to our neighborhood. This proposal can help us restore order and cleanliness to our street. It represents an important step toward reclaiming Kensington as a place where family and small business can thrive, children can grow up safely, and residents can take pride in their neighborhood again. I urge you to support Councilwoman Lozada's proposed bill as a critical step toward reclaiming our Kensington community and protecting the health and well-being of all our residents, family, businesses, and especially our children. Thank you so much for your attention and allow me to speak about today. If you have any questions.
Yes, we do. Thank you for your testimony. I'd like to first recognize Councilmember Phelps.
Thank you.
Just want to thank you so much for your testimony. I want to read you a statement that I found quite compelling from Roxy Rivera of the Somerset Neighbors for a Better Living. And I wanted to get your perspective on it because I think it kind of is in concert to what you just said. She notes that in this letter, which is, by the way, well thought out and written, she writes, hundreds of thousands of addicted people are flooding our sidewalks in front of our houses. There are competing drug dealers flocking with the providers to target these locations. There are houses and residential blocks being littered with trash, food, human waste. There's widespread predatory practices. And she goes on to say that with providers flooding the streets from about 6 to 7 days a week, multiple times a day, the poorest of the poor, black, and brown children in our community watch out there's about 64 windows in their buildings as hundreds of unhoused and addicted people are flooding the streets, shoot up drugs into people's necks and legs and other places. The last thing that I thought was really interesting that she noted, and I'll end here, she said, how is it that Fishtown can enact legislation to get rid of food trucks in certain locations, but Kensington residents can't have a voice on whether or not trucks with needles, crack pipes, mobile showers can park in front of their houses and invite hundreds of people to their block? How is it that Kensington residents are denied block party permits, but mobile providers can have block parties on their streets every day? And she says it's about time that people start to recognize that real people live and work in Kensington, and that we deserve the same basic quality of life afforded to any other taxpaying community in Philadelphia. We recognize that no one has an absolute power to end the crisis, and many theories and treatments have been implemented. However, cannot be at the expense of those who live and work and play here. When you hear that, what are your thoughts in terms of how is that, is that something that's translating into the business community as well?
Since I came to the community about 5-6 years ago, this is the daily basic. We see a lot of challenging. We saw a lot of business that they closed the door. We see a lot of people on the street. We see a lot of drug dealers. And we see a lot of community fighting, neighbors, children when they go to the school, that they see all this crisis, specifically in Kensington. And what I understand from your question and the testimony is that with this bill, we can control. Basically, one of the first problems, the trash. Impact Services provide services along Kensington community. And we pick up a lot of trash every day. And you can pass after we pick up the trash, and 10 minutes later, there is a ton of trash. And the mobile provider, they help in some way, but at the same time, they create a lot of litter, waste, and trash, which attract a lot of problems to the community, especially health issues. And it's really impact when you go to other cities and when you go to other part of Philadelphia, which is not look the same as Kensington. One of the highest problem that all business owners around has is like all insurance company. They don't want to go to Kensington. They don't want to go to provide service or any food or any partner who provide delivery in Kensington. They don't want to do it. Why? Because there's a lot of challenge in Kensington. And with this bill, this will help Kensington community to survive of all those problems.
Thank you so much, Chairman. And thank you. We're so sorry that you have to go through this every day.
Thank you.
We hope we can help.
Thank you.
I just want to note that Council Member Harrity's in the House, and that would get all 4 members of the Kensington caucus in this chamber. So would you like to say something, Council Member?
Absolutely would. Thank you, colleagues, and everyone who's come to speak on this subject. I get that this may be a little controversial for some. We on the Kensington caucus, and I'll speak for myself, I am not against the services, some of the services that they are providing. They are needed services. Nobody is saying that this stuff isn't needed. My concern is when my kids, and when I say my kids, I mean the kids in my neighborhood. My kids are grown. But when my kids have to come up And these people are out there servicing people. Some do them inside their vehicles, some service them right there on the street. Now, there's all kinds of forms of trauma. You know, there's firsthand trauma, trauma that you get from something you experience. And then there's secondhand traumas. Traumas like a kid walking to school while these people are out there servicing these people on the street. And they walk by and see this gaping wound on somebody's arm that goes right down to the bone. And maybe they overhear the person saying that if we don't do something about this, they're going to cut your arm off. Now, we may not think that that doesn't affect that child simply because they were walking by, just happened to see it, just happened to hear it. But that is trauma. That kid will not be able to get that picture out of their head because that's the way kids are. They think things, their brains are very active, and they see something like that, and then they go home and they start having nightmares because of what they saw. Thinking about somebody having to actually get their arm cut off or their leg cut off in order to save their life because they are not taking care of themselves because they are not in the right frame of mind. The drug these people are doing, it affects them in ways that normally they wouldn't be. You know, the addicts, again, they're just like us, except they have a problem that they cannot stop. It is mental as well as physical. And you've heard me talk about it many, many times before. And, you know, I'm always open with my recovery. I'm somebody who's been there. I get what they're going through. I feel the pain because I was in that pain, and that's what we call it. We say that when somebody has enough pain, then they'll do something about it. But until that point, I have children and seniors that have to walk past. Now, we're talking about 130-something thousand residents that live in that immediate area, where kids and seniors have to walk over that every day. Seniors are afraid to go to the corner store because they have to walk past 10 drug dealers standing out there, guns showing, no consequences. Right now, I live on G in Allegheny. Right now, you have a cop posted up right on the corner of G and Willard, supposedly to, you know, kind of obstruct the business that's going on there. But it doesn't obstruct anything because they know even if they get arrested, they'll be out in a short time frame, so they don't really care. It's not like when I was a kid where the drug dealers on the corner actually came from the corner, so there was a chance that they might run into their aunt or their mother or their grandmother. And they kind of treated people on those blocks a little differently because they came from that neighborhood and people knew who they were, where they lived. Well, that's not the case anymore. In my neighborhood, they rent the corners. 2 corners around the corner from me go for about $60,000 a month. Do you know how much money a drug dealer has to be making in order to pay somebody else $60,000 a month? This is $1 billion business. This bill, while I believe in it, right? Because certain things that I know from being in recovery, one of which is that if you keep giving addicts stuff that they don't have, they have less of a reason to get recovery. So what I'm saying is, people always think that drugs and alcohol keep the people out there on the street. And that, you know, for whatever reason, that's going to, lack of is going to chase them into recovery. That's not how this works. Drugs and alcohol are easy. They know how they're going to get that. They're going to do what they have to do in order to get it through a lot of other illegal things. What usually sends somebody to recovery is when it's raining out and it's cold and the person there hasn't had a fix in a little while and they're starting to come down and they're having that, what we call moment of clarity, where they say, why am I living like this? I don't have to live like this. But if people are out there giving them all this stuff, that's what usually sends them into recovery, not the drugs or alcohol or lack thereof. They know how they're going to get that. We know what to do to get that stuff. It's being out there in the cold and the rain, like I said, without sneakers, without a shelter, without food. That's when they sit there and they say, oh, wait a minute, why am I doing this? I don't have to live like this. I can go to so-and-so. This stuff is needed, but it has to be done in a controlled environment where not only do you have people providing services, but you also have someone like me walking around saying, hey, I get it. I was there. I lived on that corner over there. I know you're not ready today, but when you are, here's my card, and I'll come get you. That's how you plant the seed. That's how you do it. But you can't do it out on a street corner. You can't do it while they're out there thinking about other stuff. It has to be when you're in a facility, getting services. Pulling up on a street corner and giving services, while noble, it does nothing but destroy the neighborhood. You know, the kids have to see this going on. They have all this stuff going around. They leave trash everywhere. And we already had my colleague, Ketzi Lozada, already got them to admit that they do it differently in other neighborhoods. They take their stuff with them. They take their trash with them. But in Kensington, they leave it right where they were. You know, and we get all these other things that come with people out there giving stuff out. So they pull up on Allegheny Avenue at G Street or on Kensington Avenue and they set up and they have clothes. So you walk down the line and you need clothes, they figure, so they give them some clothes. So they take the clothes, they put it in the bag, and then they walk down the line further and they get food and they take the food, and now they got a bag of clothes and a thing of food. And then they walk about 100 feet and they get into their nod because the drug takes effect. And then they start in their bow and the clothes go here and the food goes here. Now I got a massive rat problem because the rats not only have a place to live, but they have a food source right next door. These are the things that we don't think about, the things that the neighbors are definitely thinking about, the kids are thinking about. I just believe that this needs to be organized. Information needs to be shared. And I think this is just one step in getting control of this situation. And again, none of us believe that these services aren't needed. We just don't believe that they should be pulling up into a residential area where you have kids, seniors, and everybody else walking around into a business area where somebody's trying to support their family with a business. You know, it pisses me off when people say Kensington's been like this for 60 years. That's bull. I've been living there for 17 years. And granted, when I moved around there, it was a little rough neighborhood, but I came from a rough neighborhood, and that's nothing new for me. We didn't have this stuff. We didn't have this until COVID hit, okay? COVID hit, Jim Kenney figured, okay, they're all in one spot. We know where the hell they're at, so we're just going to let them stay there till we get a handle on this. We got that. We understood that because people weren't out anyway. It wasn't affecting anybody. But now COVID's over, and people have to go about their business. Kids have to go to school. If you come down to Kensington Avenue and stand out there with me in the morning when those kids are going to school, you'll get a new education, a real new education. If you're for the people, this is what the people want. We didn't come up with this on our own. This is from us going to meetings and getting screamed and yelled at by the neighbors because they don't think that we get their issues. They know we get the addicts' issues, right? 700 to 1,000 of them we have out there. But again, we have 134,000 residents that live there. How many kids do you think that is? How many seniors do you think that is? So when you go to pass this out today, I want you to think about the people out there suffering, for sure. But I also want you to think about my neighbors who themselves are suffering. The average salary in my neighborhood is about $19,000 a year. I don't know how they do it, but they do. And they're trying to raise their family. They're trying to show their kids another way. They're trying to do it the right way, busting their ass every day for peanuts, and then have to come home from work and see what they see, not being allowed to let their kid go and play on a street because you don't know what's going to happen. I have kids that have to get HIV tests every 6 months because their parents made a mistake. You know what that mistake was? They let them go outside to play, and they kicked a needle, and now they have to go and get tested every 6 months. It's not right, man. None of this is right. But there's ways to do things, organized ways, inside where you're giving these people, they say they want to give them dignity. Well, give them dignity. Bring them someplace where they can take a shower inside, get a hot meal, wash their clothes, whatever they're going to do, and then have people walking around talking to them about what it is to be in recovery. But you cannot just allow these people to pull up nilly-nilly on a corner, leave all their trash, disrupt the neighbors, disrupt the community because they think they're doing good. And, you know, in reality, they are doing somebody good. They are. And that is the truth of the thing. And therein lies the problem. We know that it needs to be done, but we also know that it doesn't need to be done the way it's been done. They need to be good partners in the neighborhood. And these kids, seniors, and my neighbors deserve more. So I'm begging you, do the right thing.
Thank you, Member Harity, for those heartfelt thoughts. And I just do want to give everybody a compliment Impact Services. When I was in the private sector, I chaired your board for 6 years. Big fan of what you guys do down there. Thank all the team members, and thanks for your testimony.
Thank you. Thank you so much.
Hearing no further questions for this panel, and there being no other panels to testify, we will now transition to our public comment session. Ms. McDonald, will you please call the first person making public comment we have to testify this morning on the bill before the committee today?
Reverend Philip Galabador.
This guy here.
Good morning.
Please state your name for the record.
Absolutely. I'm Reverend Philip Galiebter, G-E-L-I-E-B-T-E-R. I'm the Archdeacon for the Episcopal Diocese of Pennsylvania. I'm also a member of the Clare Project, which is an outreach ministry and an arm of the Episcopal Diocese of Pennsylvania. As a point of reference, I have been in Kensington for many, many years. I was a Philadelphia Fire Department paramedic in the 1990s. I have volunteered with ministries, including the St. Francis Inn in Kensington, for the last 25 years. The Claire Project is a street outreach, not by vehicle, but by foot and backpack and a cart. And we are out multiple times each week working with the unhoused residents in Kensington. What I will say is that as a Philadelphia Fire Department paramedic in the early 90s, the Kensington section of Philadelphia was the biggest use of Narcan for the fire department in the city of Philadelphia. So this issue is not a new issue for Kensington. It has become on steroids, quite obviously. And I would disagree with City Councilman that it got worse during COVID. When it got worse was in 2017 when the city...
I'm sorry.
I do not. I have worked
Okay.
in Kensington since 1991.
You've worked in there since,
Yes.
you know, let me tell you, it wasn't like it is now.
I
and it
didn't
did
say-
happen during COVID.
Do I get to testify?
So please, don't
Do I get
come
to
in here and
testify?
try, Father, I'm trying to give you respect.
Respectfully,
I'm
Member
trying
Harris.
to give you respect, but
Please proceed with your testimony.
yes.
don't disrespect my neighborhood.
I'm not disrespecting your neighborhood. I'm saying that it has gotten much worse, but it didn't happen as a result of COVID. In 2017, when the railroad tracks were cleared on Guernsey Street, things came up. All of that problem came out and was on the city streets, and it was horrible. We have a parish that is near McPherson Square. And so we've ministered to both the unhoused residents in Kensington and the housed residents in Kensington. And it is very difficult. And I feel for all those people who live in Kensington. They were my parishioners. And everything that's been testified to is true. They have woke up and had feces on their front steps, and they have had issues with the unhoused residents. But to say that this bill is not ostensibly to end mobile services, the way it is written, it basically prevents mobile services from most of the areas in Kensington. What that's going to do is harm and kill unhoused residents in Kensington. Stopping the mobile units is not going to address the root problem. Everything that you said is true. We have walked on those streets and seen people with horrible wounds, open wounds from tranq. But those mobile services are helping to get those people treatment. If you prevent those services from being there, folks are still going to be in that neighborhood. They are just not going to have access to that care and to those resources. And I know from the partners, some of whom are here today that we work with, that they every day work on making people better spiritually and physically and getting them into treatment when they're ready. The items that were mentioned in the bill that are called for as being problems are in fact problems. But again, they are not going to go away if mobile services are stopped. For some of us, providing these services is a religious act that the Bible tells us to step up. And what you do for what some people consider to be the least of these is what you do for Jesus. And so that is part of the reason that we are on the street providing that care. I would say that this bill being put forward so close to Christmas, when those who worship a baby that was born basically unhoused, and to have this hard-hearted bill is hurtful to many, many people. I would say that there are many groups, some of them are here, and religious groups within Philadelphia that want to help solve this problem and would like to be at the table to discuss that. The person from the health department mentioned having perhaps somebody come through and clean up in coordination when services are provided. I think that there are many ways that we can address this, that we can look at the humanity of these people while looking at the humanity of the people who are living in amongst this problem. It's not an either-or problem, and preventing the mobile services is not going to make this problem go away. And all the things that have been said about the problem are absolutely true, but this is not the way to stop those issues. And I'm happy to meet with anybody at City Council to try to work on a solution with our partners where we're able to do both of those things.
Well, thank you. I just want to note the intention is not to get rid of the mobile services, it's to organize and create some order. So just want a point of clarification. Councilmember Phillips?
Yeah, just a question. You said, for how many years has your organization been working in Kensington?
Since the Episcopal Diocese has had this program since 2017.
Okay.
I have been in Kensington in one form or another since 1991.
Okay. I just want to ask, this legislation has come from the ground up, from residents who have asked for this, and these organizations, including yours, have had a lot of time to work on how to solve this particular issue. What has prevented you all from solving this issue with individuals, the house residents, having to deal with loitering, trash, and other issues that concerns such as drug activity on their steps? Like, why haven't y'all settled this by now?
Well,
solved this by now?
I would toss that question back to City Council. Like, what has the city done to prevent? This is a huge problem, and what you're seeing here is the end result of a failure of multiple systems. Okay, so you're seeing people in their worst moments who are suffering from substance abuse. Okay, and so yes, our organization has worked with other organizations to do street cleanings, but to ask us what we're doing about the drug dealing, I can tell you that at Kensington and Somerset, we have a partner that we work with. At Kensington and Somerset, the SEPTA police have been ticketing folks for loitering and being on the street, confiscating their goods, and giving them summary citations. Well, with a summary citation, you are not allowed to have a public defender. And giving a summary citation is just an evil, evil way to get people into the system. So you have people that are unhoused, they get a citation that they're not able to pay, and they're not going to walk to the district to fight that ticket. And then eventually that's going to go to a warrant. And then they're going to arrest somebody who's been in active addiction, and they're going to go to CFCF. And we just had somebody who died recently at CFCF because of drug reaction. So this is just very hard-hearted, and I think there are multiple organizations that are very willing, including religious organizations, and the Episcopal Diocese of Pennsylvania are willing to work with the city of Philadelphia to find a solution, and this is not it.
Yeah, I understand. You're absolutely right. The city has a responsibility, and that is why this particular council and this particular mayor has been really focused on really finding those solutions, but more so than previous administrations, and also previous councils. So I just want to be able to say to you that, yeah, we're doing our part. It's just now, we're going to need an equal partner as well in this battle, and we can't have people. We got to have folks to help contribute to cleaning up Kensington and not causing more of the filth. All right, thank you, Chairman.
I do want to recognize Councilmember Lozada.
Thank you for your testimony. I wanted to make the same point of clarification, right? That this bill is not to end mobile services in Kensington. It is to coordinate services. That's my first point. Number two, I also come from a faith-based background or foundation, and I live by serving the least of these. I also believe that I am my brother's keeper, right? And understanding them and living my life that way, I recognize that I have to look at this from both lenses, right? Understanding that neither one of the two populations is less than the other. And so, for a really long time, the city government created a situation where they were focused on one population while consistently hurting another. Hurting a population of people that are just trying to live day to day, raise their families, conduct business. Some of these individual people that Mr. Rodriguez just testified on, about have spent their entire life savings on a business in order to be able to put food on their table, in order to figure out how they are going to eat every single day. And we, as a government, have consistently caused trauma for that group of people. At what point does everyone that provides services in that particular footprint understand that? At what point do we say that we have a responsibility to do something, that we have a responsibility to remove people who are losing their limbs on the street, that can't think about a real opportunity to recover because their wounds are in such poor condition? At what point do we believe that we are our brother's keeper and we have to get them off the street? We have to be able to heal them physically so that we can have an honest conversation with them about recovery. At what point do we do that? I have a pack of testimony from students and staff from Conwell School that talk about their experience every day, right? What do you say to these children?
Well, what I would ask you...
What do you say to these children who in 20 years from now, Pastor, will come to you and I and say that we were leaders in their community and that we had an opportunity to do something and that we failed them?
This is all true.
And that we failed them. We have to do something in this city. The way we have been doing it up until now has not worked. We have prioritized harm reduction and the harm reduction way for a very long time.
But you can't go the
opposite.
You can't go the opposite.
While ignoring an entire community of people, right? We've ignored an entire community of people because we have focused on providing services to those who are living in addiction. It is time. We have a responsibility as a government and as people of faith to respond to the needs of both populations.
Absolutely.
That is what we're trying to do. Because we allowed for government, I sat in a meeting where we agreed with government that we would do something. And we failed them again, time after time after time.
But do you think that these people, the folks that are living on the street, this bill, we are talking about a huge problem. This bill will
coordinate services and not allow you to come on to your block. Would it be okay for me to bring
the way the bill is written, it prevents it
block?
basically anywhere in Kensington.
Would it be okay for me to bring mobile service providers in groups to your block?
But here's my question.
I'm asking you a very specific question. Would you want them to receive services in front of your home?
I have not seen those on residential blocks.
Well, then you don't work in Kensington.
Okay.
They're in photos.
I'm not saying that...
Then what you've just testified on is not appropriate, it's not factual, it's not truth. Because people Every single day, these mobile services show up to residential blocks and provide services there. Yes, they are crucial services. Yes, they are serving the least of these. However, they are impacting negatively an entire community of people that we have a responsibility to serve.
And
People
I
have spent their entire
I
life
absolutely
savings
agree with
on
you.
homes. They pay property
I-
taxes. We have a responsibility to serve them.
I'm not arguing any of that. My question is, if the mobile services stop, okay, or there was some talk about having them in coordinated locations, but do you think that what the people are exposed to is going to go away?
Coordinate these services. We are saying that these services have to be structured. We are saying that these services are vital, they're important, they're necessary, but they cannot continue to be provided in the way that we have allowed them to be provided.
And so can we
right?
sit down with the organizations that are here?
In order for us to be able to sit down with all of these people, we need to get health department, LNI, and the city in order. We need to get our own house in order first. We need to figure out a process, and then we can come to you all, because we did. We gave providers an opportunity to organize and coordinate themselves, and they did not do it. What they did was started to fight amongst each other because they wanted to choose a specific area on a specific day. You know what happened? They all showed up on the same corner on the same day at the same time. You know what happened? They created more trauma for people. We cannot allow you all to structure and organize yourselves because you don't want to. That's not what you're interested in. We need to get our own house in order first. Government has caused trauma in that community, and we have a responsibility to fix it.
Right.
And then we will put forth a process and a plan that will work
It's the
to improve
responsibility of
quality of
government
life for
to take
people while
care
still
of the
addressing the needs of
housed
those who are
and the
suffering from
unhoused.
addiction.
Both the
I'm offended that you will come in here with scripture, right? Acting like nobody here has any kind of sense of faith.
Ma'am, that's not what I said. What I said is for some of us who are doing the
For a lot of us.
Okay.
For a lot of us
Who are
in
doing
this
the
chamber,
work,
on this day,
it is a
believe
matter
that
of
we have to
faith.
serve the least of
It's
these.
a matter of
All of us,
faith.
a lot of us in this chamber, we have a different kind of counsel. We have a different kind of counsel in this body today, where many of us are believers, where many of us believe that we have a responsibility to take care of people. That is what we are trying to do every single day.
That is not what I said. What I said was for some of us that are providing those, that the reason we do that is because it's a matter of faith. I did not call into anybody's, I'm not saying anything about your faith or where, where you're coming from in doing this. My comment was that for me, providing these services on the street is a matter of faith. I was not talking about anybody here, okay? So I'm not questioning anybody's faith.
Well, Pastor, thank you for testimony today. Thank you for being here.
Thank you.
Ms. McDonald, would you call the next testifier, please?
Laura Blumenthal, Candace Player, and Kara Cohen.
I should note we have multiple testifiers, so just be respectful of everyone's time, please.
Good morning.
Good morning. Please state your name and proceed with your testimony.
My name is Laura Elizabeth Blumenthal. Hello. I'm here today to speak to the humanity that is missing from this bill. I agree with the pastor that just spoke that this is going to harm people further and not do what this bill is proposing. I've been working in Kensington for 7 years providing life-sustaining services. And what this bill does is takes away basic human life-sustaining services. We're talking about I couldn't reach my hand out with a bottle of water to someone who's dying in the sun without getting a fine. This winter, I can't give out blankets to people who are going to die in the cold. And that is what this bill is going to stop. It's going to stop the services. There's nothing about coordination. There's nothing about structure. This is just ending the services to these people who are people, just like you and I, who deserve the same respect that you and I deserve. I don't see this bill does nothing good for the Kensington community. And I understand when you say, how am I gonna get my kid out to the doctor? Well, how are the people in the street able to get any of their services? They deserve the same medical services as the people who are housed and are able to pay taxes. This looks to me more and more like, how do we get rid of people that are a nuisance to us so that we can develop, make new homes, put more money in our pockets? This city is looking more and more like a business, finding ways to make new construction to make more money, and the Kensington homeless community is just in the way, and one of the ways to get rid of these people is to kill them by taking away these life-sustaining services. This has been the trajectory of this city for many years. And if you want to talk about cleaning up, that is something that absolutely can be organized. But what I've seen since 2021, the cleanup is taking leaf blowers and blowing the sidewalk, which is filled sometimes with needles, and throwing those needles in the faces of our homeless community. That is not cleaning it up. Sorry, I just want to bring myself down a moment. This bill will only take away life-sustaining services for our homeless population, which will murder them. This is a death sentence, this is terror, and this is genocide on the Kensington population. Just like people who are housed, the people outside need food, water, medical services. You spoke of the Kensington homeless community needing respect, and I can promise you they feel respected and heard by the mobile services that are currently out there. I'll just make one more point about this bill, that there is a great intentional vagueness in what mobile services means. So I don't even need to be working out of my vehicle. I could just be myself standing on the corner, trying to give a blanket, a bottle of water, food that I'm allowed to give to a friend. I'm allowed to give to a friend if I see them in any other neighborhood but Kensington. We see the development that is happening just up Lehigh. We see all of the high rises happening, and we can see the connection between murdering these folks who are human beings so that more developments can be made, so that more money can be made, so that more people who are not seen as people can be murdered. In the street, in prison, as we have seen recently, rest in peace, Amanda. The services that are currently provided need to be funded more. We have been defunded. Were we to have more funding, we could provide more services, life-sustaining services. We all deserve to live. Instead of a bill that takes away these services, ask for a bill that funds these services to human beings. All of us are one trauma, one job loss, one injury away from being on the street. I ask for your humanity in this moment. If you take away these services, there will be more dead bodies in the street for the children to be traumatized by. This bill does not organize things. There's nothing about organization. It's just about taking it away. Thank you for your time.
Thank you. So we are left to right then. Please state your name and proceed with your testimony.
Certainly. Good morning, Chairman Driscoll and Vice Chair Squilla, Councilmember Lozada, and Councilmember Harity. My name is Dr. Candace Player. I'm the VP of Advocacy and Street Outreach at Project Home. I'm joined here today by Kara Cohen, who's the Associate Director of Integrated Healthcare at Project Home and also a nurse practitioner and a member of our street medicine team. Residents of the 7th District are understandably alarmed by the accumulation of toxic waste, litter, and discarded drug paraphernalia in their communities. No one should be expected to tolerate the accumulation of litter and waste on their streets. For many reasons, including encampment closures and orders to move along, we know that people who are experiencing unsheltered homelessness in Philadelphia are moving from busy city streets like Kensington Avenue into surrounding neighborhoods. But in order to address the rising presence of people who are homeless in residential neighborhoods, our goal must be to connect every unhoused person to housing and services. The Biden-Harris administration has specifically identified street outreach as a best practice and a key component of our response to homelessness, and for good reason. According to All In, the federal strategic plan to prevent and end homelessness, an effective homeless response system should include outreach to unsheltered people, as well as coordinated entry, targeted homelessness prevention and diversion, shelter, permanent housing, and wraparound services. Too many Philadelphians have become disillusioned by a system that is not serving them. And for that reason, we must meet people where they are by bringing certified peer specialists, mobile housing assessors, and importantly, street medicine teams to them. If Bill number 240665 were to become law, it would impede our ability to connect people who are homeless to housing, healthcare, and other vital supports. In partnership with the Department of Behavioral Health and other service providers, Project Home operates a 24-hour homeless outreach hotline. If Philadelphians are concerned about someone who is homeless or at risk of homelessness, we encourage them to call the hotline. However, if a resident of the 7th District were to call the hotline and request assistance for someone on a residential block or a sensitive public area, under the rule proposed in Bill number 240665, we would be prohibited from responding to their call. Importantly, that means we would be prohibited from providing the very services that those residents are paying for. Our outreach services are funded by a combination of both public and private dollars. If street medicine teams like the one that Kara leads were unable to reach their patients, we know that those patients would, as the pastor pointed out, still be there, and likely sicker, with more complicated medical conditions, and only to find themselves in emergency rooms where we're providing care that's more costly than it would have been had Kara and her team been allowed to provide necessary medical care and meeting people where they are. We appreciate and welcome the amendments to Bill number 240665 that have already been provided, but we would recommend further amendment to section 102802 regarding definitions, specifically the section concerning the definition of a mobile crisis response team. As currently drafted, the amendment notes that teams operated by the Department of Behavioral Health and Intellectual Disability Services for the purposes of providing community-based behavioral health services perhaps are exempted, but we would recommend that that definition is broader and includes teams that are out there not only to provide behavioral health services, but also exist for the purposes of connecting an unhoused person to housing, healthcare, and supportive services. At a minimum, teams like Kara's, street medicine's teams, must be able to provide healthcare to patients who are critically ill and on our streets. Thank you.
Thank you. Please state your name for the record and proceed with your testimony.
Sorry. My name is Kara Cohen. I'm a certified registered nurse practitioner and a certified wound specialist. I'm the Associate Director of Project Home's Street Medicine team, and I work with Candace here at Project Home. I did want to just talk a little bit about what it is that I do in a day, because I think there might be some misconceptions or people might need clarification about the types of services that we have. I work on a nurse-run team. We are all nurse practitioners and nurses, street medicine team, and we partner with Project Home's outreach team that, again, is partially funded by the city and partially funded privately. That is, if you were to call the Outreach Coordination Center, I have my little street jacket here. So if any citizen calls this number of the 215-232-1984, the chances are one of my colleagues would be dispatched. I recognize, so sometimes we are along with them to provide medical services. The services that I provide are primary care, low barrier, primary care through a holistic and trauma-informed lens. What that means is we treat people's high blood pressure, diabetes, thyroid disease, untreated HIV, gender-affirming care, pregnancy care, women's health care. We've worked with the health department before to ensure that people who have been exposed to syphilis complete the 3-shot regimen of penicillin to avoid spreading of health emergencies. We do have 2 wound care specialists on our team, so we do provide wound care. We are also there to connect people to brick and mortar facilities. In Project Home Healthcare Services, we have 3 brick and mortar clinics. All of our clinicians are located at another clinic. My goal is never to permanently provide services for somebody on the street, but I've been doing street medicine for 7 years in Philadelphia. I've been working with people experiencing homelessness for about 24 years, but 7 in Philadelphia on the street. And my goal is never to provide, I don't think I provide excellent care under a bridge or on a sidewalk, but I do think that a lot of times it's the difference between someone living and someone dying. I think that I hear the bill. The intention of the bill is not to eliminate mobile services. However, my team would not be able to function. I have several hundred patients in the Kensington area that I see for all of the things I mentioned. Another thing that had become an issue in the last couple years is the number of unhoused pregnant people, which in 2022, I believe, resulted in 13 street births, which is where someone delivers a baby on the corner. So we have made it a mission of our team to connect with people who are unhoused and experience pregnancy, and I'm really proud to report that everyone we have worked with who's pregnant has delivered in a hospital. And, I worry about the increase in not just maternal mortality, but in infant mortality, where our services to be eliminated. I mentioned before that if you call this number, you get my colleagues, one of whom, Sam Santiago, is partially funded by DBH, and Monique Taylor, who is a certified recovery specialist, and they go out. Sam has worked for 25 years doing outreach. Monique has like over 7 years of experience and lived experience as well. We receive calls from Kensington all the time in the community asking for us to engage people and help move them along. Under this bill, it is so restrictive that we would not be able to provide those services. So I worry about the language of it. I hear the spirit is to protect the people in the Kensington community, and I do appreciate that. However, the way that the bill is written right now, to shut down the wound care services, to shut down the MOUD services, I wish I could say that people were flocking to Kensington for excellent free health care, but that's not what's happening. They're there because of an open-air drug market, and they're there because of the drug dealers. The things that are mentioned as nuisances, the needles, people injecting in their necks, all of those things, they're not doing that because of us. We had come there because of them. Unfortunately, I feel that, I don't feel that, I know that Philadelphia is the epicenter for the xylazine epidemic in the United States. And when we started to see that drug introduced into our community, and now it's in almost 100% of the supplies, that's when we really began to see people not being able to move off the block because the withdrawal is so severe. And I think that is when we started to see an influx of services that are going to help people or trying to help people. I've heard the need for responsible and sustainable services, which I think is something that we provide. In my backpack, I carry, which is about 45 pounds, I do carry an array of wound care supplies. I do carry some things for procedures. I carry Depo. I carry some, which is a medication to help people with like unintended pregnancy, or to avoid pregnancy, a contraceptive medication. I provide, the injections to treat syphilis. I provide blood pressure checks. We sometimes do labs. I take everything with me when I leave. I double bag my trash because it's biohazard, and I do 2 bags and I take it with me if I can't find somewhere to dispose it that is safe. I take all of my needles. I do all of that. I take exception to that I provide care differently in Kensington than I do anywhere else. I work all over the city, and my team works all over the city, including in Aramingo, South Philadelphia, Center City, and I provide the same care and trash disposal, provide the care, same caution, the same everything that I do, no matter where I go, just as no matter where I provide services, whether I'm providing it in a brick and mortar clinic or if I'm providing on the street, I attempt to provide as much dignity as possible. I hear the controversy about treating wounds on the street. Most of the folks that we work with are not able to leave where they are. They are like stuck there. Sometimes we don't even park, we drive to them where they go. So that's how we end up under a bridge, because a lot of times they won't even walk up the block to get that care. So I do worry about being cut off from our several hundred patients. We make every effort to provide dignity and privacy, getting in the back of our SUV if we can. we try to bring someone into our brick and mortar space, I'm not always able to do that. If we were not to be present, my patients will still have gaping wounds, but that wounds will be uncovered and more infectious. They will still have diseases, but those diseases will not be treated and can spread. There will still be addiction, but there will be lack of connection to MOUD, which is the medications for opioid use disorder, and a lack of connection to recovery. And I believe in the way this bill is written right now, it will likely increase death, but it will absolutely increase suffering. In the entire time that I've been a provider, I have never seen a medical problem solved by taking away resources. I have not seen a problem solved by isolating a person and having so much suffering that they feel compelled to go do something. In fact, a lot of times that isolation makes people care less and they give up. And that is part of what we do, is that we care about people and we let them know. So I do hear what the spirit of the bill is, but I do think more amendments are needed to carry that spirit out. Thank you.
Thank you. I note that your suggestions are on the record for consideration. I do know Member Harity has a question.
Yeah, just one quick question. How many homes has Project Home given to the homeless addicted population out there? How many have you put into housing, as you say? That's your main goal. But how many of the homeless addicts out there in Kensington have you placed in housing?
At Project Home, we have over 1,000 units.
That's not what I asked. I
At Project
asked
Home, I'd like to
how many
answer.
people have you taken off the streets of Kensington and put into housing? Simple.
At Project Home, we have over 1,000 units of
Again,
housing.
that's not what I asked. I understand. I know all about Project Home. I actually like Project Home. But what I am asking you, ma'am, is how many of the homeless addicts, not the 1,000 units, I don't care. I want to know how many units you gave to these homeless addicts that are out there to be in. How many of them would that be?
I'd like to answer.
I'll let you answer
I'd like
as
to
long as
answer.
it's not 1,000 properties. We know how many properties that Project Home does. Again, I am a fan of Project Home.
So,
But
Councilman-
I would like to know a number of homeless addicts that you took off the streets of Kensington and placed in the housing. That's it. It's not confrontational. I'm just asking for a number of how many people you housed out of that Kensington homeless population that are now in housing. How many?
At Project Home, we have over 1,000 units of housing.
Ma'am, again,
And all of that
I don't know
housing,
what you're...
and all
what
of that
you're doing.
housing is open to people who
How
are
many
homeless,
people did you put
at
into
risk-
housing from
at risk of
Kensington
homelessness,
area? That's it. Don't want to know what you
at
do in the
risk of
rest of the area.
homelessness.
Don't want to know what you do
Sir,
anywhere
that's
else.
not how it
I
works.
just want to know how many. I get that.
That is the answer
I
to
get
your
that. But
question.
you're
Sir, that
supposed
is
to be
not-
out there
that's not how
doing
housing
home.
works.
You're supposed to be getting people off the street
Yes.
into housing.
And that is what happens.
The
But what you're
bottom line
asking
is you
not
haven't
how
done
it
any of
works.
that, have you?
That's-
Have you gotten anybody out off the streets of Kensington into a Project Home house?
Would you like
Yes
to-
or no?
Yes.
You have?
Yes.
I'd like to see that. That would be great.
The answer is yes. The answer is yes. The second sentence.
How many? How many? Yes, the answer is yes. You took a homeless addict off the streets of Kensington and you put them in housing. That's what you're telling me on the record here, right? That's what you're telling me. All right? You want
Councilman,
to rethink that?
no, I don't.
No.
The answer to your question is yes. The units that I mentioned include new units of housing, including the Inn of Amazing Mercy, the Fitzgerald residence.
Okay, I would just
and-
like to know
and the
that for
McGuire
the record,
residence,
I would like to have her
as well
put
as
in
Philly
writing
Home.
how many actual people, I want names, I want to know who they serviced from Kensington, put into housing. That's it.
If you could
Go on.
provide the chair at your convenience an answer to council member's question, if you can.
We can certainly provide you with that number. But the fact of the matter is that our housing is open to people with histories of homelessness, people with histories of addiction, and we have also added, because we are committed to addressing the opioid crisis in Kensington, we have also added Philly Home, we have added the McGuire residence, and we have added the Fitzgerald residence to make sure that we have units of housing to address the needs of people with opioid use disorder. And I am happy to give you the number of unique individuals who have been housed in those residences, as well as the other 1,000 units of housing that I referenced.
From the 7th Councilmatic District.
Member Harity, you can't talk over the testifiers. You'll be recognized if you'd like to be. Now, we do have a lot of other folks that have public testimony today. I'd like to...
Is it possible for me to just clarify one thing?
Yes.
So in addition to the units of housing that Project Home offers, the Project Home outreach team that I mentioned before goes around and they do this thing called contacts. If someone's not familiar, anytime they encounter somebody who is unhoused in the streets of Philadelphia, they get their name, birthday, social security number. That goes on a list to the city where there's multiple organizations, including Project Home, that do refer to various housing organizations, so the outreach is directly causative of housing those folks.
Thank you.
Mr. Chair.
Member Lozada?
I think part of the problem, and we're going to hear this consistently, right? I think that part of the problem and part of the great frustration is that we're not able to capture some of this data, right? We're not able to capture the data. We're not able to capture the data of who is out there providing services, but we're also not able to provide or capture the data of who they're providing services to, right? So I think there is great frustration. There's great frustration on behalf of the provider. There's great frustration from the Kensington Caucus and this legislative body, right? But I think that a great part of that is that very important piece of information of who's out there, what is the service that they're providing, and how many people are they providing it to. Continuing the conversations will allow us to be able to create, I don't know if it's a dashboard, I don't know if it's a mechanism where we're reporting on a quarterly or you know, whatever the frequency is, that will allow us to really capture the information around that critical information, right? We are hearing that there are more people today in Kensington than there were last year, right? And so I think that the frustration, especially from someone like Councilmember Harity, who lives there and who can see it, it's real, right? It's a real emotion. We need to figure this information out, right? This bill is just a beginning, right? I don't want people to think that this is an end. This is the beginning. We unfortunately had to legislate this process because as a government, we were not able to do it without it. But that type of information, how many people are each of you providing services to? Are there individual people? Are you serving the same group of people? You know, what is the success of your services? All of that information is extremely important for us as legislators and for the community that you're in. And so, yes, there's frustration. Yes, there's anger. But it is all as a result of the fact that as a government, we did not do our due diligence, right? I don't want people to think that we're blaming the provider. We're not. This is a government issue. Government has caused this situation to be created. And now as a government, we need to figure out how to fix it. The only way we're going to fix it is through legislation, is through conversation, is through amendments. All of these things are possible and necessary in order for us to continue to move the restoration of quality of life in that community. And so I want people to understand that, right? I want people to understand that the frustration and the anger that's here is real, but it's a result of what we as government have allowed to happen.
May I respond just briefly? Councilmember Lozada, I agree with you, and I will tell anyone who will listen that there is a clear need in this city for not only a more coordinated approach to our operations, but the collection and reporting of data. One of the reasons that is actually quite difficult to give an answer to the question that Councilmember Harity fairly asked is the way we collect data in outreach, that it is divided or operated by different city agencies. Some of those databases are maintained by the Department of Behavioral Health. Others are maintained by the Office of Homeless Services. So to figure out who specifically came from Kensington and was housed requires looking across that data set. That's not an insurmountable problem, but it absolutely is one that we need to address. And frankly, it's a problem that cuts across not only issues in Kensington, but throughout the city. So I 100% wholly agree with you.
Okay, Patrick Combe, thank you for testimony. Ms. McDonough, would you please call up the next testifier?
Jonas Levy, Naromo Finnell, Sam Stern. Jonas Levy, Naromo Finnell, Sam Stern.
Good afternoon. I guess whoever would like to go first, please state your name and proceed with your testimony.
Sure. Good afternoon. And my name is Sam Stern. I work as a physician with Temple's Begin the Turn. Excuse me. Move the mic closer. And I'm going to come closer to the mic.
Thank you.
So good afternoon. Thank you, council members, for the opportunity to speak. I really appreciate it. I really appreciate it. Again, I am a physician working with Temple's Begin the Turn mobile clinic, although my remarks today represent my own perspective and are not those of my larger institution. I want to make that clear. Our program, Begin the Turn, includes a team of physicians, counselors, and certified recovery specialists, people who themselves are in recovery. My hope is to share a few key points during a brief statement this afternoon. I'd like to express appreciation for the council members' comments about the life-saving importance of mobile units. I'd also like to share concern and opposition to the bill as written. I'd like to state that we are in the midst of an unprecedented local and national overdose crisis, and that the people most likely to die during this public health crisis are least likely to access care in traditional healthcare spaces, such as brick-and-mortar clinics and the hospital where I work. I might mention that people who use drugs are treated poorly, experience tremendous stigma, and often do not have social support systems in place, such as housing, transportation, identification, and phones. For that reason, I'd like to share that Begin the Turn, and mobile providers more generally, function to provide access to life-saving and evidence-based care to people most in need of these services. This includes provision of medical services and referral to clinical and recovery care and spaces. I'd like to make the point that these services meet people where they are already, and that rather than causing the neighborhood's overdose crisis, Begin the Turn, for example, started coming to Kensington based on existing overdose statistics and in response to an existing overdose crisis. And that in addition to the importance of our programs to our existing patients, we frequently respond to overdose events in the vicinity of our clinic and provide emergency medical care and assistance. The most important thing I'd like to state clearly today is this: mobile clinics are a response to an existing problem, not a cause. The situation in Kensington is dire, and the trauma that the council member described is undoubtedly very real. But mobile clinics are not the cause of this crisis, and are rather a response to mitigate this crisis. I'd also like to state for the record that we clean up after ourselves and we bring our trash. I'd like to make a plea for collaboration and partnership, and to offer to help develop policy that protects the quality of life of residents in the 7th District, which has clearly suffered. But I'd ultimately like to state that the legislation as written is too broad and would restrict the provision of life-saving services to people in need. I am a doctor, and these are patients with a life-threatening medical condition, and I do believe sincerely that this bill as written will prevent me from accessing my patients. I do not believe that restricting mobile units will resolve the problem or accomplish the goals of improving the lives of people residing in the 7th District, but will rather serve to further isolate people with substance use disorders and risk worsening an existing overdose crisis. Thank you for your time.
Thank you, Doctor. State your name for the record and proceed with your testimony.
Yep, my name is Jonas Levy. I work with Penn's Rock. We have our director here, Nakoma Fennell. Thank you, Dr. Stern. I will keep my comments brief to respect everyone's time. We would like to say that we began operating in the Kensington region of the city starting in January of this year, continuing a previous initiative with Kensington Hospital. Since January, from January until July, of 400 unique individuals served, not all of who had substance use issues. There were many primary care, general medical patients that we saw and encountered. Of 400 clients, we had placed 75 for specific addiction recovery services. The vast majority of those 75 were for wound care, but it was 75 nonetheless across a range of addiction services. We were able to do this successfully by collaborating with Begin the Turn, with Dr. Stern, and as mobile service providers, neither one of our operations really produces large amounts of supplies or handouts or goods. It's predominantly service-based. We will administer Narcan or hand out Narcan, but we don't provide large supplies of goods. Did you have anything else? No. Additionally, with the bill as written, it would prohibit all medical mobile service providers. I want to be clear, that is not just substance use. As written, this would prohibit mobile flu vaccination services on residential blocks. It would prohibit individuals coming towards schools to provide sports physicals if they do so from a mobile unit. Granted, I know with the recent amendments, it specified that you could get approval or exemption to operate in a special area, but there is no such process for a residential block. If there were a mobile urgent care that intended to serve members of Kensington, even though the urgent care could be providing urgent services, as written, those are not emergency services. Those are not emergency medical personnel. It would be prohibited in operating in residential blocks. Additionally, the definition of residential block is vague. While one can say the spirit is pretty clear, it doesn't clearly define frontage. Is it specified by the length of the street? Is it specified by the number of unique parcels divided by total parcels? Is it specified by the number of doors? If there's one big building that operates a whole half of the block, and then you have 6 little houses, is that a residential block, or is it 50-50? So while we support Councilwoman Lozada's efforts to improve quality of life in the 7th District, we feel that it needs to be more specific and more clear what services are allowed to be rendered, by whom, under what conditions, and what we're looking for. Thank you.
Well, thank you, and that's why we're here today, to hear this valuable information. I do want to note, from my observation, is we do have some very committed, serious service providers, and then some are not. So we're just trying to absorb as much information. We all come from different perspectives, and we appreciate what you've done, and congratulations on those 75. Well done.
Thank you. It was in partnership with Kensington Hospital and the Be Well Center at Girard.
Well, thank you. Thank you for being here.
Thank you.
Ms. McDonald, would you please call our next testifiers?
Elena Millen, Ana Lucia Riojas, Rainey Bagrum.
All right. So my
Good
name
morning.
is...
Yes, just state your name for the record and proceed with your testimony.
Good morning. My name is Elena Milan. Hello. My name is Elena Chalfin Milan. I am a second-year medical student at Lewis Katz School of Medicine. I am here to provide my own individual perspective, and I'm not speaking on behalf of Temple University or Lewis Katz School of Medicine. I am here to comment on the bills under discussion today, which propose to restrict vehicular mobile service providers in Kensington on the grounds that we contribute to an unsafe environment for Kensington residents. I have worked with several of these vehicular mobile service providers and therefore find myself in a position to comment on some of the myths that are being propagated about our work. First, the idea that we or our participants leave extra trash around is, in my experience, untrue. Every single organization that I have ever worked with brings a sharps container and goes around blocks where we operate to get rid of discarded needles and other paraphernalia. Every single organization that I have ever worked with makes sure to clean up trash around the area before leaving. If anything, we try to leave the streets cleaner than when we arrive. Second, the idea of increased confrontation from our participants is also, I think, unfounded. Most of us who serve people who use drugs in Kensington have learned how to de-escalate conflict, and participants who come to us understand that there are rules, that we will not tolerate yelling, fighting, or other disruptive behavior. We also respond to people who need help so that they are not left suffering and dying on the streets, which I would argue is a way of reducing the amount of disruption to the surrounding community. I have directly witnessed individuals who work with us making sure that participants stay off the stoops and the streets of nearby residents. The final reason that the bill gives for restricting vehicular mobile service providers is that we expose residents' children to traumatic and frequently unsafe conditions arising from the fentanyl crisis. Again, I hear what our council members are saying, the testimony that has been given by people who live in Kensington, as I do not, okay? I understand that. And as a student who is trying to help this community, I want to make sure that we're doing that in partnership with housed and unhoused residents. So I understand that that trauma exists, but again, the mobile service units, we are not the cause of that. And without our services, more people will be there with open wounds. More people will be dying, will be struggling, will be traumatizing people who live in the area if we are not there to help, to connect them to services. I also want to point out that some of the people who get help from these organizations are children and are seniors. They are children and seniors who live in Kensington. Is depriving them of these services, of food, of hygiene products, of connections with healthcare providers they might not otherwise have? Is that reducing their exposure to the conditions arising from the fentanyl crisis? That is my question. Finally, I will say that many of these vehicular mobile service providers are, in fact, healthcare providers and health professions students like myself. We want to work with our communities and not against them. We share the goal of making a happier, healthier, cleaner Kensington. Thank you for listening to my remarks. I beg you not to pass this legislation as written.
Thank you. Next testifier, please state your name for the record and proceed.
My name is Lucia Riojas. That is spelled Luciariojas. Thank you, everybody, and good afternoon, council members and everybody here. My comment is against the bill number 24-00665, introduced by Council Member Lozada. By the way, I get what you say about seeing the reality from both lenses. That's your job, yes. But this bill isn't that. It isn't providing that. Also, I don't get why here we've heard council members asking the organizations and people that dedicate their life to serving Kensington what the solution should be, because that is your job. That is the government job. That is why you represent the people, all people, and accountability is something that should be provided from the government to the people and not the other way around. This bill will eliminate life-saving services by banning organizations to help people that live in a very deplorable way due to issues that concern us all. I don't believe that banning mobile life-saving services will be the solution to a much more profound problem, a public health problem, and it also lacks of any propositions on how to seriously address the problem from the roots, not only to try to put a Band-Aid on a really deep wound. I think that is something that has to be worked on, the bill that is introduced. Banning the services would limit access to Narcan, medical care, and basic necessities such as food and water. I mean, it's that simple. It's, basic life, basic dignity. It is also worth to say that we serve not only people without a home, but also people who have a home in Kensington. And as my colleague here, or whatever, we're not colleague, but my new friend here, I have to say that, yeah, when we go and provide these services, we try to leave the space that we're working in like cleaner than we found it before. So that is very important because it's been an issue to address here a lot. No? Council Member Lozada has decided to introduce a bill that tries to implement a decades-old strategy that has been proven to be a failure, with scientific evidence available from all over the world. I don't have it with me right now, but I mean, again, it's your job as, lawmakers, as representatives, to study all that evidence and take in account, scientific evidence so that you can represent the people that got you here in a better way. In the current political climate, the city of Philadelphia should be an example of forward-looking politics that put people and dignity first. And I just wanted to repeat, this is a matter of empathy, dignity, and caring for the people who need us. Mobile units are not the problem, they are part of the solution, actually. So I think it would be a mistake to pass this law. Thank you.
Thank you. Please state your name for the record and proceed with your testimony.
Hi, my name is Rani Begum, spelled R-A-A-N-I, last name Begum, B-E-G-U-M. And I've been a resident of Philadelphia. I've been organizing in Philadelphia for the whole time that I've been here. And I've actually been living in your zip code since 2014 to 2020, after which I was displaced out of it because of developers and rising rents. I've also been organizing in the Kensington area since before 2018, so I'm actually very familiar with all of the arguments, both from the resident side, the harm reductionist side, the council member side. I've actually been there for all of it, including for when legislation for Safe House was being pushed, and people said that they didn't want it in their neighborhood. I'm bringing it up to say that this idea around, services should be here and not here, here and not here, is a very, very, very old argument that has been happening in Philadelphia, and it is extremely clear that the unhoused population, not just the drug-using unhoused population, but the unhoused population in and of itself is unwanted by the residents, quote unquote, of every single neighborhood, which I don't believe it's true. And so part of what I'm trying to do here is testify, on both sides of the lens that you keep saying, Councilmember Lozado, not only from House residents, which I'm very lucky. I have family, I've always had help. I'm very lucky to be a House resident of Philadelphia, even when I was displaced out of Kensington, but also as a person who's been organizing with unhoused members and who's been on the brink of eviction and on the brink of houselessness way too many times since I've been alive. Right? And I think that it is, in fact, really important to talk about what we can do to restore dignity in our neighborhoods in Philadelphia, right? The first one is housing. So I think it's really interesting to me that right now, you, Councilmember Lozado, and you, Councilmember Harity, were arguing with representatives from places like Project Home. There has never been actual legislation forwarded by any Philadelphia government that does anything about the rent, about developers, and how people are displaced out of the spaces that they are living in, right? Inflation in the United States right now is one of the Philadelphia has the highest inflation in the United States. Developers are coming in, they're actually displacing people out of their neighborhoods, out of their homes. And so I'm really glad that we're talking about children and we're talking about the elderly and the trauma that they experience, because I know, having done mutual aid in Kensington since 2018, that a lot of the people that I'm talking to are actually historical Kensington residents. The elderly, a significant portion of the elderly people in Kensington are historical Kensington residents that have been displaced out of the home that they were living in these neighborhoods. I don't hear any concern for them. I just hear for the concern for residents that are already there who are, again, either in Kensington because of new development, because so much new development have been pushed since I have arrived, which, again, I've been here for at least 10 years, right? A lot of concern for these developments and these residents who then are not actually local to Kensington, are not actually historical to Kensington. They're just people who have just a little bit extra money to be able to gentrify Kensington. And those are the residents and their children that you seem to be really concerned about, since they're the only ones who seem to be able to hold on to their housing. Because I wasn't. A lot of my friends were not, right? I actually also want to talk about actual, real, meaningful, common sense harm reduction services. People keep talking about Kenny, and people keep like implying, vaguely saying that maybe something, whatever Kenny did was like harm reduction, and it, it like was terrible for Philadelphia. I said earlier that I've been organizing since 2018 because one of the things that was proposed in 2019 got cut off and then reproposed in 2020 was PAD, Police Assisted Diversion. The idea that a cop will come to an unhoused person and connect them to all these magical social services that exist in the city of Philadelphia. They don't exist. They don't exist. What ends up happening is that people like end up at a precinct, they get maybe 2 bottles of water, they do not get connected to any services. The services that they do get connected to are places like Salvation Army, which don't have housing. I know this because I ran a relief fund program from late 2020 to late 2021 just to get people cash. And all of these services that police-assisted diversion were supposedly connecting people to, all of these services ended up servicing people to me, one person who was just fundraising on her own and trying to get people indoors, trying to get people to safety. The city of Philadelphia has never, ever, ever actually have had real services, real resources around housing, and we have been asking for housing first models since before 2016. Since before 2016, so I don't understand this conversation that is happening right now about, COVID changed the game. People have been awful to unhoused people, myself included, since way before then, right? It is also really important to talk about these things because, like I said, these are arguments around, when we have services in the neighborhood, all of these people flock, and then, the residents can't stay safe or whatever. We've heard it since Safe House, since before Safe House. It's a very old, very age-old argument, right? And it is not true because if you actually listen to common sense things, you know that when services are actually connected in the same place, a couple miles within the neighborhoods, a couple blocks from each other, a lot of services in neighborhoods, it actually really enriches the neighborhood. Not only the unhoused people, but the housed people. Housed people also have medical services that they can get to if housed people are experiencing, not being able to pay their rent, not being able to pay their bills, not being able to pay their mortgage. They also themselves know that they have these services available in their, within a couple blocks of themselves. It does not actually deter them. Do want to talk about harm reduction services again, because I'm hearing a lot of, there's needles everywhere, people are pissing and shitting everywhere. Since that conversation around Safe House, Kensington has at this point eliminated every Sharps box that used to exist in Kensington, which means that people don't actually have anywhere for their trash to go, right? Porta potties have been eliminated from the neighborhood, and so now people don't have anywhere to actually just go to the bathroom. And public bathrooms, there's only one public bathroom that exists in the city of Philadelphia, and it's in City Hall. The cruelty, the absolute cruelty of asking somebody in code blue weather, where there is no more any services. It used to be that in code blue weather, Philadelphia would roll out warming stations and buses and all of that. That has been eliminated since, I think, the last 2 years. That doesn't exist. The absolute cruelty of making people go from neighborhood to neighborhood to neighborhood. Hey, you can go to the bathroom here. Hey, you can get medical services 17,000 miles from over here. The absolute cruelty is actually astounding to me. It's astounding to me that you're sitting here saying that, you're trying to look at it from both sides of the lens or whatever, because you're not. You're not. And lastly, I Again, want to talk about common sense, actual harm reduction services, and not the ones that fancy suits in City Hall pretend that they're talking about, right? I think it was in September, a couple months ago, Kendra Brooks organized an entire session for harm reduction people to come and have a conversation about what services are needed and why they're needed. You walked away from that conversation. You are not actually listening to us. You're not actually coming to the table for any common sense conversation. You walked away from a public hearing that happened right here. So to come here and say that you are trying to, you are not trying to eliminate services, you're just trying to make sure that everybody's coordinated. You have historically walked away, both of you have actually historically walked away from these conversations, right? Because had you been in these conversations, you would have heard how Overdose Prevention Point in New York City, in Harlem, New York City, 1 Point NYC, has changed the game for the entire neighborhood so that they went from thousands and thousands and thousands of needles on the street to zero within the first week of their opening. We can have that. We can have that here. We have been asking for this since before 2017. Harm reduction organizers have been talking about safe supply so that, this issue around drug dealers and whatever violence happens on the street gets reduced and eliminated. But nobody actually listens to us. Some fancy suits comes in here, talks about recovery, and then it's like, oh, I'm doing it all. Did you know, since you seem to know a lot about services, if they have true services or not. Recovery services do not take in anybody if they have wounds. In fact, emergency departments in the city of Philadelphia will often turn away people if they have xylazine wounds, especially in the cold, because there's so many other patients coming in, and they look at this person, they'll be like, oh, you're just coming in here getting drugs, when there are wounds all over their body. And so they end up back on the street. So yeah, I imagine it's traumatizing for your kids, because I cannot imagine being a child and then watching the adults around me look at another human being and say, oh, that's terrible. It's their fault. They should be left out to die, just as long as they're not outside of my home, just like they're over in that other neighborhood, just like they're not outside of my home, but also not in City Hall, but also not outside of City Hall, because then developers cannot come in. Because then developers cannot come in and, have these new trashy buildings that are sinking. The buildings that they're building are sinking in Fishtown and Kensington. But hey, we have to develop these neighborhoods for them so that they can make money. The fact that this is a city, that Philadelphia is supposed to be a city of brotherly love and sisterly affection, has been dying in City Hall, and your bill is a nail in the coffin. Your bill is a nail in the coffin, because it hasn't just started there for the last however many years. You want to talk about why people are on the doorstoops of people's residence? Because the police keep shooing away unhoused people. Again, there's no housing. There's nowhere for unhoused people to go. So if the police is going to come and harass and terrorize people out of the parks that they were living in, and I get it. We want to use our parks for the kids, for this and that. So if the police come and terrorize people out of the parks, then they're going to go somewhere else. And that's going to be on your doorstep. They're there because you and your police evicted them out of the places they were living in, evicted them out of the tunnels, under the bridges that they were living in. You are reaping exactly what you sowed. And now you're here talking about trauma and how it's so sad that people are how it's so sad that people don't get services when you're the one taking those services away. It is bone-chilling how an entirely cruel bill is sort of being cushioned, is sort of being sugar-coated with conversations around trauma and care and this and that. It is bone-chilling how this is happening. Thank you for your time.
Well, thank you for that passionate testimony, all your testimony. Thank you very much. Ms. McDonald, is there any more testifiers for this morning?
Yes, one more. Silvana Mazzella.
Hello. Good morning. State your name for the record and proceed with your testimony.
My name is Silvana Mazzella. I'm with Prevention Point Philadelphia. And I wanted to just express some concerns and also clarify some things that were said. There are many mobile units in Kensington, but it was stated that there are no mobile units in other communities. There have definitely been other mobile units in different communities across the city. We've operated several units in other parts of the city, and we've collaborated with other people in other parts of the city. But it's also worth pointing out that we place mobile units in areas that have the most need. In fact, many of the mobile units that are operating in Kensington and other parts of the city are operating specifically, quote unquote, following an overdose spike. So the health department or others might set out an alert about an increase in overdoses in a particular community, and this has certainly happened outside of Kensington, and a mobile unit will place there either immediately to distribute Narcan, do overdose prevention education, meet with pharmacies, community block captains, or it will stay there for a period of time to saturate that neighborhood with Narcan and offer people substance use treatment. There are also units that specifically follow HIV incidents, right? So we know that in different parts of the area, and part of the increase in mobile services in Kensington was paired with increases in new outbreaks of HIV infection, but that happens in other parts of the city as well. And in addition to Narcan, overdose prevention, HIV testing, there are also offers of PrEP, or HIV primary care. I also want to point out that there are people here that have been coordinating a mobile service provider meeting since at least 2020, 2019. Before that, the health department and DBH co-facilitated a mobile service provider meeting. The first one that I went to was held at the health department, and after that it was held at Rock Ministry, and then moved to other parts of the city. It's now, I believe, mostly virtual, but there are two people here that coordinate that, and a range of mobile service providers meet. There are sometimes people from city government units that meet in that. And I say that to say that all of us that provide mobile services want to collaborate with the city. We want to be good partners. We want to be better partners. And part of the discussions that happened today have been had at these meetings, negotiations with other service providers around not necessarily being on the same block, the same day of the week, the same time, but trying to coordinate in a way that we are hitting multiple areas across a week or across a month, and not necessarily providing duplication of efforts if we can do slightly different things. I also, the discussion of being long-term, most of the mobile service unit providers are not trying to replace brick and mortar services. I do agree with the council member that brick and mortar services, to me at least, are ideal. We can provide a range of services under one roof in the most dignified way. But there are many people that are still not going into brick and mortar facilities. When we enroll people in mobile medical care, as an example, we do a PDMP lookup to see where else they've gotten substance use treatment and how often. We gather records, we consent them to contact their managed care entity to find out a recent hospitalization or something else. And there are many people that we find that have not had care even in the last year or two. So for some people, brick and mortar is ideal, but for many people, mobile services are their first engagement with care. I can also tell you that, for example, for our service, and I would believe that most of the mobile providers here that use an EMR on their mobile trucks will find people that, since their entry to substance use treatment or wound care or some other healthcare service on the street, are actually still engaged in care. They're still adherent. They are housed now. They're either employed, they're on Social Security, and they are living stable lives. And that happened through that initial engagement that may have then, a month, 3 months later, transitioned to brick and mortar services. So it is not always meant to be a long-term service. We respect and accept the need for more regulation, and we do clean up after ourselves. I think it is only right and reasonable that providers that provide mobile services do that and show respect for the community. And I just want to restate that we are, the ones that participate in regular meetings are interested in partnering with the city, are interested in being the best neighbors possible, but these services have to continue. If there are going to be regulations around where a service can be provided, think someone earlier talked about, there are many mixed-use blocks with residential and commercial services. We would expect some type of blueprint, but also some engagement with mobile service providers, with the health department, with DBH and council to really look at where need is, so that we're not just looking at residential and commercial, but looking at placing services where there is the most need so that they can operate.
Thank you.
I'm not going to
You
testify.
were good? Okay. Well, thank you for your testimony.
I did want to add one more thing about homeless outreach that I meant to add that was discussed before. The mobile outreach, we have a homeless outreach team. When calls are made into the Project Home Hotline, we are one of the service providers that goes out and responds. And we did over 400 placements to shelter last year. It's also notable that there are times where there is not an eligible placement for someone, where there just is not a spot. And that's definitely more extreme in the extreme winter and summer, but that happens. It's also notable that at least, you know, the outreach teams, part of the job is documenting the chronicity of people's unsheltered status and trying to make them eligible for placement. So it is not possible for all of the mobile service providers, ourselves included, to take everyone off the street. It's simply not realistic. But the best that we can do is try to offer care, provide life-saving medical care in that moment, especially for people who are not going to get care elsewhere. And as I said, we often find every day that we're out on the street, people that we treat that have not gotten care elsewhere, and then to try to make them eligible for other types of placements.
Thank you. And thank you to all our testifiers today. This was very, very, very helpful for this panel. There being no further questions from members on the committee and no other witnesses to testify on Bill number 240430 and Bill number 240665, I will ask, is there anyone else present in this hearing whose name we failed to call?
Good afternoon. My name is Catherine Abrams. I work for the Health Federation of Philadelphia. Thank you, Councilperson Lozada, Squilla, Driscoll, Phillips, O'Rourke, and Hannity. Good afternoon. I know it's been a long morning. I'll try to keep this brief, but I feel like my work has been mentioned a couple times. I do training and technical assistance on behalf of the Health Federation of Philadelphia. My program is contracted by the Substance Use Prevention and Harm Reduction Division of PDPH to do training and technical assistance. We host monthly meetings for mobile medical teams, and this came as a result of a request from one team about 3 years ago. So Silvana there were, what she mentioned, the meetings, they were going on, and then it kind of fell apart, and then we responded to the technical assistance request to meet with the medical teams, and these are the licensed teams. So our outreach was directly to the medical teams. Over time, our group has expanded, and we have relationships with some of the harm reduction groups that are here today. What I thought the groups would talk about when we first started meeting, and the initial request was around location, I thought we would talk about location. Where is the best place to go? And we really went with the data about where overdose was the highest, and so Kensington became the priority. Over time, I thought that what the group would talk about was, how to provide the best services for addressing hepatitis C, for example, which is hard to do on a mobile van. But trash has been on our agenda for 2 years. And there is consensus among these groups that trash is a priority. We don't want to add to the problem. I cannot control what these groups do, but I can offer a space for them to meet and try to discuss the concerns of the community, and we do that often. Frank Franklin had introduced me over email recently to Mike Cameron, your legislative director. We gave him the date of our meeting. I asked to meet with him beforehand just so that I could, learn more about what was going on. We didn't hear back, and I know it's, busy. It's a busy time. We thought maybe this legislation wouldn't be on the table, and maybe that's why we didn't hear back. We are open. I think the groups would welcome a discussion, a sit-down. It's just the way things happen, the neighborhood meetings that they go to, a lot of yelling happens, and it feels hostile. So I have to say, I'm not here to oppose the bill or support it, but just to make sure that you know that there is some coordination happening. The groups respect each other, they like each other, and we try to support the best practices. And really one of those best practices is making sure that we're doing good in the community. They want to do good. That's all I have.
Thank you. Thank you very much. This concludes the public hearing of the committee. We will now go into public meeting to consider the action to be taken on the bill before this committee today. Ms. McDonald, will you please call the roll to take attendance? Members that are in attendance, please indicate that you are present when your name is called.
Councilmember Gilmore Richardson, Councilmember O'Rourke, Councilmember Jones, Councilmember Gaudier, Councilmember Phillips,
Present.
Vice Chair Squilla,
Present.
Chair Driscoll.
Present. So before we make a motion, I just want to thank again all the testifiers today. This was important. We wanted to get this on the record. This is not the end of the process. This is the process, and we want to get it right. And I think I can speak for the members that are here, and I think I can speak for the maker of the bill. The maker, do you want to say anything? Member Lozada?
Thank you, Mr. Chair. I'd also like to thank everyone that came out today to testify. I appreciate, I've heard, again, I think that this is the beginning of a long-awaited conversation and a long-awaited process that needs to happen, and it's a process and a structure that we as government have to establish in order for us to ensure that both populations are receiving the absolutely necessary services, right? And so I look forward to continuing the conversation. I've received some text messages from individuals who were here today who testified, who want to continue the conversation, who want to be a part of the process. I welcome that. Again, I think it's important for us to ensure that both populations are heard and respected, and that we're able to deliver for both of them as a government, as elected officials, because that's what we're responsible for.
Thank you. I just want to recognize Vice Chair Squilla.
Thank you, Mr. Chair, and thank you, Councilmember Lozada. As we heard, there's a lot of good points on both sides of this argument, and the challenge is, what do we do to make it work? And I think a lot of people understand, hearing from the community side of it and hearing from the unhoused side of it, that we have a lot more work to do. And I want to thank the sponsor of the bill for her commitment to continue working on this and to work not only with the colleagues here, but also work with the providers, the health department, L&I, and all our departments to continue to work on this until we get it right. So thank you for your passion. Thank everybody who testified, and knowing that we will continue to work on this as it moves forward. Thank you.
With that, the chair recognizes Councilmember Squilla for a motion on bill number 240430.
Thank you, Mr. Chair. I move that bill number 240430 be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit the first reading of this bill at the next session of council.
The chair notes for the record that Councilmember Scrilla seconds the motion. Oh, no, we need a second.
No.
Second. Oh, second.
Councilmember Phillips
Second.
seconds the motion. It has been approved and properly seconded that bill number 240430 be reported from this committee with a favorable recommendation, and further moved that the rules of council be suspended to permit first reading of this bill at the next session of council. All those in favor of the motion will signify by saying aye.
Aye.
The ayes have it, and the motion carries. Let me, for the record, Councilmember, yes. Yes, Councilmember O'Rourke.
First of all, I want to just say that
So let me just get the record. So the ayes are Councilmember Scrilla, Driscoll, and Phillips. Councilmember O'Rourke, a nay, and you can now proceed to comment.
thank you, Chairman, and also want to send my regard, give my salutations again to Member Lozada, as well as Member Harity, as well as the other colleagues, and also thanks to all of those who did come out and give their testimony today. I know we're about to wrap up, but I just want to share this. I'm a freshman, and I'm new to this, and this is really my first day on the committee.
I just want to clarify this. The bill that we voted on was the L&I bill.
Oh,
you
that's
want
it,
to
yeah.
vote, you want to be a nay on the other bill, correct?
Then yes, I stand
All right,
corrected.
so let's just for the record, let's do the motion again, just to, this was on the L&I bill.
As I was saying, I'm a freshman, so I'm messing
That's
things
right.
up. I apologize.
We welcome you anyhow.
I'm sorry. I'm sorry.
So let's just do that vote again.
Thank you. Thank you, Mr. Chair. I move that bill number 240430 be reported for this committee with a favorable recommendation, and further move the rules of council be suspended to submit the first reading of this bill to the next session of council.
Second.
The chair notes for the record that Councilmember Phillips seconds the motion. It has been moved and properly seconded that bill number 240430 be reported from this committee with a favorable recommendation, and further moved that the rules of council be suspended to permit first reading of this bill at the next session of council. All those in favor of the motion will signify by saying aye.
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 The ayes have it unanimously, and the motion carries. Now, this will be an amendment to, this is an amendment to bill number 240665.
Thank you, Mr. Chairman. I offer an amendment to bill number 240665. A copy of the amendment has been circulated to all members of the committee. I move that the amendment to bill number 240665 be approved.
It is,
Second. Second.
the chair notes for the record that Councilmember Phillips seconds the motion. It has been moved and properly seconded that the amendment to bill number 240665 be approved. All those in favor of the motion will signify by saying aye.
Aye.
The ayes have it. The motion carries. The amendment to the bill number 240665 has been approved. Now on to the bill as amended. The chair recognizes Councilmember Scrilla for a motion on the bill. Did you want to speak, Councilmember O'Rourke, before we vote? Please, Chair. Yes, I recognize you now.
Thank you, Mr. Chairman. Again, my salutations to those making these mistakes as a freshman. Let me just say that we have clumsy tools in trying to do civic surgery. This has become evident to me in the last 11 months of lawmaking, which makes interpreting the moves, the actions that are taken, a bit difficult without explanation, which is the reason why I wanted to at least a little space to say this. I want to be clear that I care deeply about this bill's goal of creating better living conditions for the residents both of your district, of the 6th district and the 7th councilman district. That has to be remembered, I think, in lawmaking. There is the letter of the law, and then the half the right of the New Testament calls the spirit of the law that is also active in that. And so capturing that spirit within the law is essential, I think, if we're going to do the right or righteous thing. However, as the health commissioner mentioned in his testimony, I fear this bill will not accomplish that. Research consistently demonstrates that harm reduction practices are the most effective way to deal with the opioid, mental health, and homelessness crisis that humans and citizens continue to face in our city, saving more lives and tax dollars in the process. That doesn't mean that the community's relationship with harm reductionists is perfect or regulated well, as we've kind of ironed out here today. But since these methods are the ones that actually preserve life, before we get to the question of the quality of life itself, I believe that we're tasked with improving relationships and improving regulations. At its core, this bill regulates where these vital services can take place. It does not address the underlying causes of the issues faced by Kensington, which did come up in this conversation in the 7th District and too many other neighborhoods in our city, as has been articulated. There is common ground in this legislation. That became evident as well. For instance, the amendment requiring better spacing. Member Lozada talked about that. That makes a lot of sense to me, about spacing it out so there's not hard concentration in certain areas. Multiple providers on a residential block is a challenge that very few people can deny, I think, if we're being honest in our lawmaking. The pictures are compelling enough, the testimonies even more so, because I see the pictures today, but I was in the meeting at McPherson Park in the summertime, and I heard that come from folks. But again, if this is the work that is keeping people alive, giving them the opportunity to survive a dark time, we can't just sweep it off the board. Philadelphians who choose to help those in need do not need more hurdles to jump through. They need our help. And I consider that to be essential work for those of us who are tasked to etch out a common life together, as hard and as difficult and as intense as this thing can be. I look forward to continuing to work with all of my colleagues on finding ways to address these and many related issues facing our city, but I must urge us all to pursue a different course of action here. My hope is that you believe my desire to find what that right course of action looks like. Thank you, Mr. Chairman.
Thank you, Member Alert. The chair recognizes Councilmember Squilla for a motion on bill number 240665 as amended.
Thank you, Mr. Chairman. I move that bill number 240665 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended with the first reading of this bill at the next session of council.
Second.
The chair notes for the record that Councilmember Phillips seconds the motion. It has been moved and properly seconded that bill number 240665 as amended be reported from this committee with a favorable recommendation, and further moved that the rules of council be suspended to permit first reading of this bill at the next session of council. All those in favor of the motion will signify by saying aye.
Aye.
Those opposed? Motion carries. This concludes the business before the Committee of License Inspection today. Thank you all very much for your attendance.